Hello everyone, myself Dr. Asmita Katti, practicing gynecologist and fertility specialist from Belgavi. Today we are going to discuss about most common woman health problem, that is PCOS. What is PCOS? It is also known as polycystic ovarian syndrome or polycystic ovarian disease, that is PCOD. So it is a problem with hormone which occur during reproductive age group of a woman. If you are having PCOS, you may not have periods very often, or you may have periods that last for many days. You may also have one hormone which is excess in your body, that is called as androgen. In PCOS, ovaries may develop small fluid-filled sacs along the outer edge of the ovaries, and these are called as cyst. So it is a polycystic ovarian syndrome. So the exact cause of PCOS is not known, and it is a multifactorial disease. There are various factors which are responsible for it, like first is insulin resistance. What happens in insulin resistance? So insulin is a hormone which is secreted by pancreas, and insulin allows cells to utilize sugar, which is main energy source of a cell. And if cell becomes resistant to this insulin, it will lead to buildup of sugar in your bloodstream. And because of high sugar level in your blood, your body will try to secrete more and more insulin. And because of this excess insulin, it causes to release of excess of androgens from the. Second cause is inflammation. Third cause is excess of androgen, which leads to improper functioning of the ovaries, like it doesn't release its egg properly, and that causes irregular menstruation and fertility problem. PCOS is also considered as a hereditary problem. So research suggests that some genes are responsible for PCOS, and if you have family history of PCOS or diabetes, type 2 diabetes, you are at increased risk of having PCOS. So these are the causes of PCOS. Now we will see about how the diagnosis is made. So according to American Society of Reproduction, if patient is having at least two of the following clinical features or criteria, then only we consider as a patient is having PCOS. When patient comes with a ultrasound report of a PCOS ovaries, that doesn't mean she's having PCOS if the other criteria are not met. So which are those three criteria? First is polycystic ovarian appearance on the ultrasound. So on ultrasound, your ovaries might appear bigger, more in volume, and they show multiple fluid-filled sacs along the outer borders. And if they are polycystic in appearance, then we label them as a PCOM, polycystic ovarian morphology on ultrasound. This is one criteria. The second criteria is androgen excess. So how it is detected? Through clinical symptoms, and second one is through blood test. So what are those clinical symptoms of having androgen excess? So having excess facial or bodily hair, having male pattern of baldness, or having acne. These are the symptoms and signs of having androgen excess. Then the third criteria of PCOS is irregular periods. So when to see a doctor? If you are having irregular periods, that means your period length or cycle length is more than 35 days, or you are getting very infrequent bleeding. Second, if you are having trouble in getting pregnancy. Third, if you are having any symptoms of androgen excess like acne, hirsutism, or baldness, male pattern of baldness. Third one is excessive weight gain. Then you should see a doctor. Now we will see about how the diagnosis is made. So diagnosis mainly depends on clinical features, examination, and ultrasound and other blood test or hormonal analysis. What are the long-term complications of PCOS? These are infertility, then metabolic syndrome, developing type 2 diabetes, hypertension, obesity, sleep disorders, sleep apnea, anxiety, depression. Then if patient is pregnant, risk of developing miscarriage, gestational diabetes and hypertension during pregnancy. Also, patient is at a high risk of developing endometrium cancer, that is a cancer of inside lining of the uterus here, if the disease is not controlled on long-term basis. So coming to the management of PCOS, it mainly focuses on managing the things which are troubling you, like if you are having excess hair growth, then the treatment plans accordingly. If you are having acne or irregular periods, then mainly hormonal treatment. And if you are having trouble in getting pregnant, then the treatment mainly focuses on fertility treatment and ovulation inducing agents. So coming to the specific management of the PCOS, it mainly focuses on lifestyle modifications and medications. So in lifestyle modifications, you have to control about your weight through low calorie diet and combined with exercise or bodily activity. Even modest reduction in the weight, for example 5% of your body weight reduction, may help you to control this disease. And specific medications like hormonal treatment and ovulation inducing agents as discussed before. So to control this problem, stay at a healthy weight, limit your carbohydrate intake and stay active. Thank you.